An enlarged and bulbous or club-shaped root is usually a sign of. It indicates hypercementosis. Now, what is hypercementosis? Hypercementosis, or the term used is cemental hyperplasia. It means that there will be excessive cementum. So there will be deposition of excessive cementum. And on radiograph, what would you see? In radiograph, you would see the affected tooth demonstrate a thickening of the root. In this figure, you can see this root is thickened. The enlarged root, it is surrounded by radiolucent periodontal ligament space and the intact lamina dura. Which tooth are more commonly affected in hypercementosis? It's the mandibular molar that are affected most frequently, followed by mandibular and maxillary, second premolar, and mandibular, first premolar. Hypercementosis occurs predominantly in adulthood, and the frequency that increases with the age. What are the factors that are associated with hypercementosis? That could be either local factors or systemic factors. The local factor include when there is abnormal occlusal trauma, there could be hypercementosis, or adjacent inflammation like pulpal, periapical, or periodontal involvement. The systemic factors, hypercementosis may be associated with acromegaly, pituitary gigantism, arthritis, Paget's disease of bone. So if you get an MCQ, in which disease does hypercementosis is seen? The answer would be Paget's disease, rheumatic fever, thyroid goiter, Gardner syndrome, or vitamin A deficiency. Now on histopathological examination, you will be able to see deposition of excessive amount of cementum over the original layer of the primary cementum. What is the treatment of hypercementosis? It requires no treatment.